Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. A little news before we go to Dr. Fine. First, the national job numbers came out for last week. Those numbers are quite difficult as well. 6.6 million Americans filed for unemployment in that week, pushing the number up to around 15 million Americans have filed. Rhode Island is one of the hardest hits. Those numbers continue to spiral. As of yesterday, it was 165,000 who are out of work. Programming note, at 1 o'clock, Governor Raimondo will be back doing her briefing. The limitations on that is reporters are not allowed to ask questions directly of her while the public can hear it. Strange but true, even Donald Trump allows that, but Governor Raimondo does not allow the press to ask her questions directly when the public can hear it. Let's go to Dr. Fine. Dr. Fine, how are you, sir?
I'm good, thanks. Yourself?
Let's go to the numbers. Excuse me. We're pushing those numbers up pretty high in the United States.
They're going to keep rising, unfortunately. In the United States, we have 435,000 infections. The good news is the rise was a little bit smaller overnight, but just one night doesn't change anything. About 31,000 new infections around the world, 1.5 million people tested and infected, 340,000 recoveries. That's an important number. And then, unfortunately, 90,000 deaths around the world and 14,000 deaths, almost 15,000 deaths in the United States. We will be around the world over 100,000 by Saturday. And that's at the beginning of this. So we're looking at a world death toll, upwards of 500,000, probably upwards of 1 million, unfortunately.
Dr. Fine, yesterday, this director of the CDC seemed to imply that the numbers that had been given out, I think it was over the weekend by the White House and the CDC, that the range of number of deaths being modeled was 100 to 240,000. He seemed to say that that number might be significantly lower. Your thoughts on those comments?
I would be very cautious about calling them any lower. I think we're, with 15,000 deaths already, and really just nibbling toward the beginning of the crest in some cities, but not across the nation. I think we're going to be between 100 and 150,000 at least, most unfortunately.
The press has started to shine a light on New Zealand. Their prime minister, she closed down the country functionally, locked it down, stopped all immigration. In the third week in February, I want to say, they have 1,200 cases and 1 death. What's the lesson from New Zealand?
It's the lesson we're learning over and over again. Similar lessons from Germany. Close down early, manage tightly. I don't know what they're doing in New Zealand, and I'm going to start to look now. I looked originally, but I haven't looked recently. But I'm curious about what they're doing about isolation, because I think part of this trick is closing down and part is isolation. That's what we learned from other places. South Korea also has done exceptionally well. As a nation, they've got 10,000 cases and 200 deaths in a nation of many millions. So we need to be looking at South Korea. We need to be looking at Germany. We need to be looking at New Zealand. New Zealand has the great advantage of being totally surrounded by water, having no borders. So they have some advantages, and they have an amazing prime minister who I'm a great fan of. So let's see what we learn as we look at these other places more intensively.
One of the other counterpoints that has come out is a prominent New York physician who says we should not, ventilators is the wrong treatment, it should be oxygen. Have you heard anything about this and whether or not there's any truth to the science that he's promoting?
The consensus in the critical care world is to go to ventilators early and do them in a certain way so as to rest the lung. I have not seen much discussion or much science about no ventilator use. There's actually some discussion about whether non-invasive pressure support, things like BiPAP and CPAP, should be used or not used. But the consensus I've seen is people who are in trouble need to get on the ventilator earlier rather than later, and use a bunch of technologies to essentially rest the lung and let it recover.
Got it. Let's go to nursing homes. I think it's more than half of Rhode Island's deaths are linked directly to its nursing homes. We knew early on, very early on, in the state of Washington, that nursing homes were very, very vulnerable environments. The disease spread quickly, and it was deadly way too often. What are we doing well here, and what do we need to up our game in addressing the nursing homes here in Rhode Island?
Nursing homes are going to be a major challenge, and I fear a major tragedy. And I don't think there's anything we can do so easily to address them. I know my old colleagues at the Department of Health are working hard to try to make sure that people who are infected are segregated, that they're not in the same parts of the nursing home as people who are uninfected. They're trying to restrict the use of staff. That's all really good public health practice. They're doing some thinking about setting up nursing homes that are for taking care of COVID patients and setting up nursing homes that aren't. But the problem is this damn disease, which has asymptomatic carriage. So you can't tell which staff member actually has it. And once it gets into the nursing home, you've got havoc. That's the challenge. The other thing I think we're going to need to look at is that we got a lot of small nursing homes. And those small nursing homes, it seems to me, are going to have real trouble with staffing, particularly as both patients and staff gets ill. How we're going to address that is a little unclear to me, but I'm sure those colleagues are thinking about it and thinking about it hard. But in many ways, this is just a no-win situation. This is going to be our biggest immediate challenge.
The coalition called Raise the Bar, which is urging that the state adopt minimum staffing hours at nursing homes. Rhode Island is the only New England state that does not have such a requirement. And Rhode Island's average staffing hours is 42nd in the country, according to the coalition. Is calling for an immediate action by state lawmakers or by executive order. Can we wait around for the legislature? That literally may never meet this year.
I don't think so. I mean, this pandemic is unroofing major holes in our policy and public approaches. So, we should have been paying nursing home workers way better than we're paying them now for many years. We should be paying CNAs who work in home health way better than we're paying them now. Most CNAs leave to take jobs working for McDonald's because they do better there. How absurd is that? That's the thing that we're going to have to find a way to address. We're going to have to find the money to address it. Minimum hours, better pay. People are talking about hazard pay. All of those things seem to me to be real considerations, because I fear that we're going to have a nursing home or two in Rhode Island that basically can't be staffed. And that's going to be a really big challenge for everyone.
Yes, I mean, listen, we're already running into complexities because the unemployment benefits, the federal dollars are $600 minimum per week. So many low-paid employees are making significantly more on unemployment between their state and federal benefits than they did working full-time. So that's going to be a complexity, and those dollars are guaranteed for 4 months. Let's jump over to the trends you're seeing in Rhode Island. ICUs is growing, but it's not hit danger levels yet, but it does seem to be picking up a pace.
Well, I think our use of ICUs are expanding. We had 45 people in ICU beds yesterday. That's up from 18 on the 3rd of April. And that's the number we got to keep our eye on. Again, I don't know what our actual ICU capacity is. It used to be about 180. If we double every 5 years and only had 180 beds to work with, we'd be beyond capacity in 3 or 4 in about 2 weeks.
I think the number we were given early on in early March was there were 188. And then pressurized oxygen capacity was at 122 at that point. I don't know if there's been any expansion of those since then. We're still not shut down. There's still exposure out there. Manufacturing, God bless them, we need them, but they're still operating. If you go around the streets, it's better than it was 3 weeks ago, but you go by any construction site, there's no 6 feet of social distancing going on in any of those work sites. Are we just egging this on to be worse than it needs to be?
Oh man, I think this is the big challenge, and this is where flying without science is so difficult. I mean, I don't know that a construction worker working outside with the mask I don't know whether that person is at great risk or not at great risk. And that's, I think, the challenge for everyone. And I hope we'd evolve science as we go, but if the pace of disease escalates instead of quiets, I think we're doing really well in Rhode Island, but if it should escalate, boy, that would be a place I'd be looking at early. As regretfully as regrettable as that is, that's going to be what it may take if our work so far hasn't done what we need to do. But I'm hoping and trusting that everybody's looking carefully at character, at the job descriptions of people who are sick, so we begin to learn what the high risk occupations are. We're hearing about grocery clerks, and I'm hoping that we're looking in the same way about construction sites, and we think about how to mitigate the risk in places that are in fact high risk as opposed to our theoretical high risk.
Listen, there's 2 types of testing. One, we finally have got up and running and we're starting to hit a decent level at just under 2,000 per day as of Wednesday. That's the analysis of, are you testing positive? That's taking place both through the National Guard and via CVS at Twin River. The second type of testing, which seems to be critical based on all healthcare experts as well as economic experts, is that we need to have a firm understanding of what percentage of the population has the antibody. That level of testing is not taking place in Rhode Island at any organized structure. There's actually a physician in North Attleboro who has created his own drive-through operation to be able to offer that as a service to folks. Do we need to, right here and now, not only continue to increase the testing for detecting it, but also the antibody detection?
Well, I'm hoping the antibody, what's called serology, will come online and be available more widely as time goes by. But they have a different use. The PCR testing, the immediate testing, the testing we're doing to see if people have the disease, it's obviously important to know who has the disease, though it doesn't help us at all know who doesn't have the disease.
Right.
The serology is helpful to know who had the disease and what percent of the population has had the disease already in different communities. I would love to see us doing, I've been talking about this for 6 weeks. I'd love to see us doing a community serologic surveying so that we're testing the blood of 1,000 people in 3 or 4 different communities every couple of weeks, at least, to see how immune we are as a state. How useful it is for an individual, I think, is yet to be seen. It may be useful for frontline and other healthcare workers to know if they've had the disease so they can feel more comfortable going back to work. But we don't have any recommendations about that yet. But it is a powerful and important tool when used in the right way, though it's not to find out if anybody's sick. That's important for everyone to know.
Dr. Fine, what else do folks need to know before we break today?
I think just keep doing what they're doing. I think Rhode Island is doing incredibly well compared to everyone else in the country and around the world. You know, I think people need to stick with it, at least in the short run. I'd love to know that we had lots more ICU beds available as this goes forward. But I think staying with it and respecting the suggestions about social distancing are really important. I also think it's important for people to talk to each other, not only for support, but to remind each other of the importance of what everybody does every day. And if I may, for people who are going to go to Seder's tonight by Zoom, it's important for them to be there and be together by Zoom. And to all of those folks, Aziz and Pesach. Have a good, safe Passover. And for people who are going to be paying attention to Good Friday and Easter, I hope those holidays are meaningful and happy.
Dr. Fine, as always, great information and a great tone for Rhode Islanders. Greatly appreciate you taking the time. We'll be back at 1 o'clock with Governor Raimondo on her briefing. Thanks, everybody, for tuning in.